welcome to Something to Talk About. I'm Linda McNamee, and for the next hour, we are going to be talking about a topic that might be important to many of you, or maybe have a personal relationship. I know I do. We will be talking and celebrating, I guess celebrating is not the right word, recognizing National Multiple Sclerosis Awareness Month. I think that's correct. But before I begin, I would like to invite you, if you have any questions or comments, please feel free to give us a call at 781-270-9199. Or if you would prefer emailing me, you can email me questions that I could forward. Or if you have a topic or idea for a topic for a future episode of Something to Talk About, you can email me at talk@bcattv.org. And I apologize now. Hopefully I will not lose my voice. I do want to thank my crew, my wonderful crew that is very faithful. We have Colleen Moore, Director Extraordinaire, who gives up her Wednesday nights to come help me out. And we also have Tatiana Hawkins, who is a volunteer here as well. And she has given up her Wednesday evenings to come help with the show. We also have staff members, Corey McNeil and Kyle Ruffin, who help keep BCAT functional and going and looking great all the time. So thank you guys. And last but definitely not least, I want to thank my husband Paul for staying home for Daddy Date Night. Now I would like to introduce my wonderful guests. Thank you for coming out. We have, I know I just practiced it right before we came here, Steve Sookikian. Okay, Steve. We'll call you Steve. That's a lot
good.
easier. Thank you. And Jodi Dwyer, who are going to represent the National Multiple Sclerosis Society this evening. And thank you for coming.
You're welcome.
Thank you for having us.
And you guys can kind of battle it out who wants to go first. But as usual, in all of the shows, my audience knows about me. They don't want to listen to me. They'd rather listen to you. So can we start out, and can you tell me a little bit about yourselves, where you grew up, how you came to the Eastern Massachusetts area, and how you became involved in the National Multiple Sclerosis Society?
Why don't you go first, Jodi?
Ladies first.
Sure. I grew up in Franklin, Mass, and now live in Boston, Brighton actually, and work in Melrose, so not too far from here. I went to college down in North Carolina at Elon University, and I went to grad school at Boston College after moving back here.
What'd you go to grad school for?
I have a master's in social work.
Oh, cool. Now, do you do social work now?
I do. I'm a medical social worker at Melrose Wakefield Hospital.
Oh, okay. Cool. Not to, disclose any big secrets. Feel free to just say, I'd prefer not to answer that. And how did you become involved in the National MS Society?
So after being diagnosed with MS, I looked for resources online of what was available and found the National MS Society pretty quickly, and signed up for a walk to do with my family pretty quickly after being diagnosed. And it just snowballed from there. Now I'm involved in 5 or 6 events, so it just grew.
Now I would like to hear your story a little bit more, but as a sneak preview, when were you first diagnosed?
2008.
Okay. We'll get back to that in a second. Or maybe a couple minutes. Steve, you're up.
Okay.
How'd you get involved in this whole kit and caboodle?
I've always worked in the nonprofit sector. Actually, even when I was in high school at Waltham High School, which is where I grew up, I was involved with an educational program called Metro Pathways, which some people might remember, where they were trying to overcome busing with suburban and urban school systems, moving kids back and forth voluntarily. So that was an interesting experience. And I went to college in Worcester at Clark University, and then went to Rhode Island and studied at the Trinity Repertory Conservatory for a couple of years, and did theater and so forth in Rhode Island, and then started working for an international charity in Rhode Island known as Child Reach at the time. And that was a very interesting experience, worked there for 10 years, and then relocated to Waltham, and then started looking for for work in the area and found the opportunity at the National MS Society. And
Excellent.
one of my coworkers in Rhode Island had been diagnosed with MS while we were working together, and then my mother reminded me that I had the father of a childhood friend had passed away from complications of MS, and I had a cousin whose wife was diagnosed with MS. So suddenly it came out of the woodwork.
So it's got like a more personal
and in fact, one of my cousins, a third cousin, was diagnosed with MS after I started working for the society. So it's
so that cousin knew who to call.
It's out there, absolutely, yeah. A lot of people, a lot of different connections, and I've been with the society since 2000.
Okay. Now, everyone in the audience knows I have a cheat sheet for questions, but you already made me think of a question that was not on my cheat sheet. Do you happen to know offhand, ballpark figure, how many people are affected personally by MS?
Worldwide, there's about 2.3 million people who have MS.
Okay.
In Massachusetts, there's somewhere between 12 and 13,000 people whom we know about who have MS.
Okay.
And I put it that way because MS is not a reportable disease. When
Really?
a doctor diagnoses somebody with MS, they do not have to register that diagnosis with the Centers for Disease Control or any other national registry. It's simply a diagnosis between them and their patient.
So people could choose not to contact.
Yeah, the only reason why the National MS Society knows that Jodi had MS is because she called us and said, I need some information about MS. I was just diagnosed.
Wow.
And then we put her in the database. And
it's kind of scary that people would not reach out to you.
well, many people do, but we have a very strong suspicion that there are more people with MS out there than we have in our database. Because it's pretty common for us to be contacted by somebody who's been living with MS for a number of years, but that's the first time they've contacted us. And if you look at the predicted prevalence rate, which is about 800 per 100,000 in the northeast of the United States, and you apply that to the Massachusetts population, we're at that predicted prevalence rate. We have a pretty big suspicion that there's more people out there with MS and that the prevalence rate is probably not accurate. In fact, the society and a number of scientific institutions are working to revise that. And at the same time, we're lobbying with the federal government to create a registry and require so that we would have an accurate picture of the impact of the disease on the country, the economy as a whole.
Now, in the statistics, is there like a more target audience? Does it affect men more than women, or, is there an age range that it tends to find itself being,
Yes, there is. It actually affects women almost 2 to 3 times more often than men.
Really? Okay.
The average age of diagnosis is between 20 and 50 years old.
That's quite a range.
It is quite a range. In fact, the truth is that children are diagnosed with MS. It's fairly infrequently. There's maybe 15 to 20,000 cases in the country of pediatric MS, but it could be teenagers most commonly, but also young children.
Now, what about like ethnic? Does it?
Ethnic. That's a great question.
There?
So historically, MS is most strongly identified with people of Northern European ancestry. And there is no MS in native populations around the equator. And on the continent of Africa, and it's very, very low incidence in South America. Anywhere around the equator or very tropical countries, there is no native MS in the population. If there are people there with the disease, it's because of changing demographics and people marrying other people that didn't grow up there.
So let's get down to basics. What exactly is MS?
Well, MS is a chronic disease that affects the central nervous system. The disease process is that the white blood cells in the blood system are activated, and we're not quite sure why, but something activates them to behave abnormally, and they pass through what's referred to as the blood-brain barrier. So normally the immune system doesn't operate within the central nervous system. You don't typically find white blood cells running around the central nervous system. So these white blood cells get activated, they pass through the blood-brain barrier, and they mistakenly identify the myelin insulation around nerves as if it were an invading germ, and they attack it, they strip it away from the nerve, leaving the nerve exposed, just like an electrical cord stripping away the rubber insulation, and it becomes exposed, it short circuits. And the way we talk about it is that MS interrupts the messages from the brain to the body and within the brain. And it can stop people from moving forward in their lives. Wherever those lesions, if you will, those scars, those attacks occur in the central nervous system, that'll determine the type of symptom that a person would have. Optic neuritis, vision problems are very common as the first symptoms, mobility impairment, but it's not always dramatic. It's not always temporary paralysis or temporary blindness. Sometimes it's numbness and tingling or a strange hug. They call it the MS hug around the midsection, where you just very tight constriction. There can be cognitive impairment. There can be bladder and bowel dysfunction. So it all depends on where that person's MS is attacking their central nervous system.
Oh, wow. Okay, let's give Jodi a chance. That's like really powerful. What is your experience? How were you diagnosed? What symptoms were you exhibiting that made you, put a red flag in your head? And, was there any family history of MS or?
So like I said, I was diagnosed in 2008, September of 2008, and I had no family history. No one else in my family has ever been diagnosed that I know of. And I think my diagnosis story is a little bit different than a lot that I've heard because it all happened very quickly.
Okay.
I woke up one morning and was numb on the left side of my body.
Ooh.
Laying in bed, just thought, maybe I'd slipped on my leg funny, just felt like pins and needles, that feeling you get when you sit on your foot too long or something. Got up and proceeded to get ready for work and realized that, my face was numb, my head was numb.
Now, did you ever think stroke or?
No, I kind of didn't really think it was that big of a deal. It just seemed weird. Proceeded to go to work, told a couple of my coworkers. They thought I was crazy that I was at work and not calling my doctor. So I proceeded to call my doctor, and they wanted to see me. So I went in and was examined, had a neuro exam, which now I've had, 500 times.
Too many times. I could give them now.
And actually, he wasn't that concerned. My balance was fine. My strength was fine.
Now, did the numbness go away at that point?
I was completely numb, but I could still stand on one foot. I could still, push his arm away, things like that. So he actually consulted with a neurologist. Coincidentally, it happened to be at an MS center at St. Elizabeth's. And the neurologist wanted to see me the next day. I guess there was enough of concern based on my age and the symptoms that I did have. So the following morning, I went over and saw the neurologist, and he was kind of the same way. He didn't think it was all that concerning. My exam was otherwise okay. By that point, I had become more concerned and was a little bit more emotional just about, what's going on
knowing
here.
What's going on.
And he
now, did the numbness remain, or so it wasn't
I was
like
still completely numb, and he said, probably that it would be nothing, and that I would never know what it was, and it would be some fluke, type of thing. But he said, just in case, I'm going to do some blood work and check you for Lyme disease, and I'm going to send you for an MRI. And he never really mentioned MS. I had already Googled, of course, the night before of what this could be. And I'd seen MS, but never really thought about it.
Sometimes Googling things can be kind of dangerous.
I'm my own worst. I'm a medical social worker, and I tell people not to do that, and then I go and do it. So went and had an MRI, was told I could go home after, but then when I came out of the MRI, they actually told me to wait.
They changed their minds.
Yeah. So at that point, my parents had actually driven to the hospital and met me there, even though I told them not to come, which I guess ended up being a good thing because we were told to go back up to the doctor's office that he wanted to see me. And at that point, he told me that I had MS.
So it can be tested for, because I've heard in the past, like I was telling you before the show, this friend of mine, her father was diagnosed a long time ago, but I think either her sister had some medical issues and they were being tested, and they said there's no test for it.
It's not a test in that there's a marker that says you have it or don't have it.
Okay.
It's medical data that gives the doctor the big picture, and it's what we call a clinical diagnosis. And there's certain criteria that have to be met. For example, you need to have an attack, 2 different attacks over a period of time.
Okay.
But
now, you only had one, but it was because it was prolonged?
Well,
Or
that was my first recognized by the doctor attack, but actually looking back, I had symptoms for years.
Okay.
And these days, because the doctors have more tools at their disposal, they're more inclined to tell a person that they believe they have MS, even though they might be not be making a technical diagnosis.
Okay.
And there are medications that are approved for, I don't know if you would call it pre-treatment. So the FDA says, yes, you may give this medicine before you have a full clinical diagnosis. So kind of like
be a little more proactive?
Yes, because the medications have been proven in clinical trials to inhibit the second attack. And why make somebody suffer that second attack if we can prevent it from ever occurring? So,
so kind of like possibly putting those white blood cells in check so they don't cause further damage?
Exactly,
kind of?
exactly.
Okay. No, I did not go to medical school, so I'm sorry for
Neither
making
did
it
I.
sound remedial.
So actually, when they do the MRI, they do 2 different series of images. They do one just regular, and then they inject dye through an IV into you.
Okay.
And I guess my doctor's always explained it that you can see if it lights up, if the MRI lights up, it shows that there's activity and lesions in the brain
if you
that
start
are
glowing.
Yeah, that are basically inflamed, and the inflammation is what's causing whatever the issue is you're having. So on mine, they could see that.
Okay, so your parents were with you, so it wasn't like you got knocked over.
Yeah, it's still pretty shocking to literally be healthy and then be told you have a chronic illness and need to be admitted to the hospital for a week and can't go to work. And so I mean, it's pretty significant.
It's life changing.
So yeah, I was.
But at least you weren't alone. I mean,
it turned out to be good. So I was admitted to the hospital and treated with steroids for the next 5 or 6 days, and then able to go home.
And then you contacted Steve and his crew.
Yep, so probably within a couple months, I was watching for when the walk was going to be, because the Boston Walk every year is in April.
Okay.
I got diagnosed in September, so I think it comes out in the late fall when the date's going to be. So I'd been watching, and as soon as I saw when the date for the walk was going to be, my family had shown interest in doing an event, so we got together and got a walk team started, and the rest is
let's
history.
talk about the walk. Why not? It's on the second page of my notes, but we can talk about it now. So there is a walk coming up. You said April 12th?
We have several weekends. April 11th and 12th is the first weekend.
Okay.
And Boston is happening on the 12th. But on the 11th, there are walks in Newburyport and I believe Marblehead, Worcester, and...
so the information's for where they are and when is on your website.
If you go to walkmsgne.org, you'll see all the walks in Massachusetts, in Maine, New Hampshire, Vermont, and Rhode Island.
Greater New England.
That's right.
Okay.
Or most of New England.
Yeah. The great part of New England. No. So do you have to have a team? Can you walk individually or?
Yeah, you can do either. I've always had a team, but individuals can come too.
Okay.
And you can show up that
Because I
morning
keep thinking
and
like
register.
the Relay for Life, where it's helpful to have a team because it's supposed to be like a 24-hour.
The Boston Walk's the 3-mile walk. It starts at BU and it goes out along the Charles River, and then returns to BU, and there's a lunch afterwards provided.
Okay. Now, as a team, are you required to raise a certain number of funds, or is it just like an entry fee and then everything else is bonus, or?
Well, there's no minimum fundraising required.
Okay.
But we work with people to encourage their fundraising. We have prizes and incentives for folks to do fundraising, and of course,
Get a T-shirt.
$100 and you get a T-shirt for Walk MS. But there are more appealing prizes for higher levels. And Jodi, what's your fundraising been at? You've been a prize fundraiser for some time.
I don't know individually for the Boston Walk. The Beam team's raised over 73,000 since 2008.
Wow.
Or 2009, actually, we probably started fundraising.
Oh, okay.
And we have the website where you register for the walk, gives you fundraising tools. You can upload email
cool.
addresses to it and send out email
Oh,
messages
so that's
from our
how
website.
sometimes I get, I'm participating in this. Click here to sponsor me. Oh, okay.
Yes, and then that information is tracked on the website so the individuals participating can see who's donated to them. You send them thank you letters, you have a little thermometer tracking your progress, and you can tell your own story about why you're participating, upload a photo to that site, and you can recruit other people to join your team all through the email system there. And people raise a lot of money. For the Boston Walk alone, we'll probably raise, several $100,000. But the walk event that takes place in the 5 states that our chapter manages will raise close to $3 million or over $3 million with all those different walk sites. So it's a very important fundraising event for us. It drives, that money drives the research for the medications that Jodi and other people with MS depend on to live their best lives. It's not a cure, but it helps to inhibit the disease activity and let them, behave and lead a normal life to the extent possible. It doesn't work for everyone. There are people with progressive MS for whom the medications do not work. And which is even more important that we continue to fundraise because we need to unlock that part of the disease. And just as a quick side note, last fall in Boston, there was a gathering, the world's largest gathering of MS health professionals and scientists and researchers called the committees, the American and European Committees for Research and Treatment in MS. Some 8,000 medical and health and scientific professionals were here in the city. And on that stage, as with that conference going on as a backdrop, the National MS Society, along with its international partners, announced a $30 million commitment to over 6 years to fund research in progressive MS. One of the issues is that because progressive MS behaves differently than the relapsing form of MS, the metrics we have for developing medications don't apply. So they have to develop new metrics altogether.
Now, I do want to discuss the differences between the two forms of MS, but thinking of treatments and then medications, you were mentioning before the show that the medications haven't been around for a very long time. When was when did they start?
1993 was the first time that a medication, a disease-modifying medication, was approved by the U.S. Food and Drug Administration for MS. Prior to that, Jodi mentioned steroids, and they still use steroids to get the inflammation under control, but you can't live on those, so these, the first line medications were basically interferons, and there was one synthetic molecule as well. There was self-injectables, and I don't know what treatment you're on, Jodi, but the society does encourage people with MS to be on one of the therapies because they have been demonstrated in clinical trials to have effectiveness. And these are self-injectables. You had
little EpiPen type thing.
Yeah, and the different frequencies, once a week or every 2 or 3 days. Some of them were every day. And you can have some adverse reactions with that, not to mention the phobia that some people have with needles, or the injection site pain that people have, like today it's my left arm, tomorrow it's my right arm, the day after that it's my left thigh, and then my right thigh, and it's not fun. But they are effective.
You got to weigh the consequences, and do I overcome my phobia of needles, or do I suffer from?
Well, people will have their spouses do the injection if they can't deal with it. But the medications are generally effective for most people. But as time progressed, so that was 1993. I started working for the society in 2000, and
over that 7, 8 years.
So shortly after I started working, another medication was approved, and then As we got around 2010, several more were approved.
Okay.
They were infusion medications. So once a month you would go into the hospital or to an MS center or clinic
okay.
and have an infusion all day, you know, at an infusion center. But that was the only treatment they received for a month or, I don't know,
Okay.
maybe a couple of months. And now, I think in about 3 years, so this is 2015, I think 2012, 2013, 2014, we saw 3 new pills come
Oh,
on the
wow.
market, which were very effective. And so that's a great, you know, new option for people with MS to take an oral medication rather than injectable.
Now, you mentioned the 3 different forms of receiving this medication. Is it up to the individual to choose which medication he or she wants, or does it depend on the progress of the disease or how they are affected by it to dictate?
Well, that's an interesting question because up until now, it's been a choice between the patient and the doctor.
Okay.
They have a conversation, they understand you know, the frequency of dosing and
Okay.
so forth and particular side effects that medication might have, and they make a choice. And they go through a trial period, see how they respond to it, and if they want to, if they need to move to a different medication. Or if they don't respond well, then there's a second line, you know, recommendation. Some of the infusion medications are really reserved for secondary treatment if the first line medications aren't effective.
Okay.
However, there
always
is
a however.
research going on now that is using genetics, huge genetic study going on where they took the human genome data
Okay.
and are using that data to identify the genes that make a person's immune system susceptible to MS.
Oh, okay.
Now they're taking that data and they're applying it against the treatments to try to predict who will respond better
to which medication?
to which medications.
Oh,
And there's a doctor in Boston, Dr. Philip Dieger, received the Brancic Prize in Innovation in MS Research last
Cool.
October, and we're going to recognize him in May at a special dinner
Excellent.
as well for his contributions. He's pushing that research forward, and the genetic research that he's basing it on was originally done as a collaboration between MIT and Harvard Medical School at the Broad
Wow,
Institute in Cambridge. So Boston, the medical and scientific community is really at the front edge, the forefront of MS research.
Now, the medication that exists now is, you know, we mentioned more of a proactive. It will, if I'm understanding this correctly, it will keep the disease from progressing at a high rate. It will not correct the damage that's already been
That's
done.
right. It doesn't provide repair.
Okay.
And when it's working well, when people respond to it well, it inhibits disease activity and lessens severity of attacks when they do occur, and spreads out the time in between attacks. So if somebody responds really well to the medication, you know, the time in between their attacks is a lot longer, and they may not, you know, remember when the last time they had an attack was, and if one does occur, it would be mild compared to
Milder.
what it would have been otherwise. And the expectation and the experience, the observation is that this is keeping people more active, more productive, living more normal lives, as opposed to prior to 1993 when there were no medications and the disease could progress unchecked. But there is no repair. So that, and what we're working on that as well. We're working on every front one can imagine. What our objectives are to stop disease progression, restore lost function, and to end MS forever, which really talks about prevention. And that's a much bigger picture that I couldn't begin to get into.
Now, Jodi, if you feel comfortable, you know, I'm assuming you were on some version of the medication. And how has that affected your life post-diagnosis?
So I've actually been on 3 different treatments. When I was first diagnosed, my neurologist offered me 2 different options. And at that time, there were only injections available. There were no oral treatments. So for 5 years, I did injections once a week. And it was, you know, it was doable. It was manageable, but not fun. and I stayed pretty stable. And then when
Now, sorry to keep interrupting you. Did the numbness eventually go away, or is this something that you just have to live with?
So for my initial diagnosis, it did go away after I had steroid treatments.
Okay.
So now I only deal with it on an occasional basis.
Okay.
Um,
And is it always the same, always on your left side, or does it?
no,
like,
not always.
Okay.
It's weird. Sometimes it's just my feet, my hands. It
Okay.
varies. So then when some of the oral treatments came out, I talked to my neurologist about switching to one of those because it was a little bit more
Easier.
desirable to take a pill than to have to do a shot. The other thing that was hard with the shots is they have to stay refrigerated. So, and you have to take it out like a half an hour before to let it warm up before you do it, so it's less painful. So even just like coordinating doing it was a
Yeah.
pain with travel or being out.
I was about to say, you
out
can
of
never go on
town.
vacation.
Yeah, it was just hard. So I started one of the new oral meds and actually had a poor reaction to it. I got just very sick, nauseous from it after a few weeks of doing different things to try to be able to tolerate it. So went off that and then started another oral treatment option that I've remained on now for probably like a year and a half.
Excellent.
And it's a daily pill. It's very easy. I've had no side effects at all. Whereas when I was doing the injections, there were side effects like flu-like symptoms every week when I would do it.
That's
So
not fun.
this has been actually pretty easy.
Great. Now, I don't know who wants to answer this, but just thinking stream of consciousness, it does affect nerves. It does affect sometimes mobility, sometimes, do people with MS find themselves going to some kind of therapy, either physical therapy or occupational therapy, or, is there ever an instance where they need a different specialist to come in and help them?
Have you
Yeah, I've
ever done
actually
it?
gone to physical therapy during the time since I've been diagnosed. I can't even remember. It was several years ago, but I was having issues with actually my right side. My left side was originally my side that I had problems with, but then I was having issues. And even without telling my neurologist, when he did an exam on me, he could sense a difference in my muscle tightness because you can get very spastic where your muscles will get really tight. So I was having some issues, and I went to physical therapy for, I don't remember how long, several weeks.
Did it help? Or
Yeah,
is
it did.
okay?
And it was just one of those things that whatever was going on with my body at that time, it was affecting that. And now I haven't really had problems with it since, and I've had other issues. So it tends to, for me, come and go and change on a regular basis.
One of the things that the society does is to encourage people to participate in health and wellness programs because with any chronic illness, of course, health, for everybody is important, but when you have a chronic illness, it's particularly important to maintain your health at an optimum level,
Right.
Because the body needs to be stronger to compensate for the chronic illness, and so that you can, continue to participate in life, fully. So we encourage people to participate in exercise, and we have a variety of different options
Does
that
diet
we
help
offer.
at all?
To the point where you have a healthy diet,
Okay.
yes. There are some folks who follow particular diets that work for them in a way, but there is no prescribed MS diet. There is a great interest in vitamin D, as people
You'll
know.
just have to go to the beach. Darn.
Yeah, it's not a bad prescription to get.
Vitamin D, has a big impact on the immune system. And if you recall, I mentioned that there is no native history of MS in equatorial areas. Well, you have high degree of sun exposure in the equatorial areas.
That's a connection.
Sun
here.
exposure helps the body produce vitamin D. And there's a lot of experimentation and scientific study in vitamin D's influence. There's some belief that it could, in a sense, inoculate the body against MS. So even if you're born with this, susceptible immune system, if you have enough vitamin D, at 0 to 5 years old,
You can keep it in remission without, well, remission's the wrong term, but
to inhibit it from becoming
sprouting.
becoming active.
Okay.
It's a very complicated disease, and there are many things about the immune system overall, which is one of the most complicated systems in the body, that science is still struggling to learn. And we don't know the answers to this, but that's why the funding from Walk MS and the other fundraising events that we do is very important, because even though we're thrilled with the success that we've had to date, that we have all these different treatment options so that Jodi can stay, relatively healthy and participate fully in her life, it's not enough. There are still people with progressive MS for whom the medications don't work at all. And there is still the possibility that people can get MS. So we want to stop the disease progression. We want to restore the function that's been lost for people, and we want to prevent anybody from getting it forever.
Hasn't happened yet.
No, but there is interesting research in that. In fact, there is a clinical trial going on right now by a pharmaceutical company in Cambridge, Mass, that is studying a compound that can help the body remyelinate the nerves. So if you've got remyelination of the nerves going on, and you've got another medication that can inhibit disease progression at the same time, that's a pretty good one-two punch. So we expect that within the next few years, we'll have the result of those clinical trials, and the company will most likely be putting that in front of the FDA for review and approval. So we've all got our fingers crossed, but so far the preliminary test results have been very promising.
Okay, now I mentioned this earlier that we would go back to it, so now seems to be a very good time. You mentioned there's the progressive form of the illness and then the other... Relapsing. Tell me about those.
The differences. Okay, so the very brief answer is that relapsing remitting MS is one where you would have a relapse. You would have an attack of the disease, unpredictable. Don't know when, don't know how severe, don't know what the symptoms going to be.
I hate surprises. That would not be good.
Or how long it will last. But it would go into remission at some point. Again, don't know why or when or how, but the disease would go into remission and you'd return basically to a normal state.
So there would be no evidence of having had that episode?
That's right. If you had temporary blindness, your sight would return. If you had temporary paralysis, your movement would return.
So like your numbness just went away. Okay.
In progressive forms of the disease, there's continual disease activity. Which generally leads to accumulating disability.
Which is probably what my friend's dad has.
If they have disability, then they have a progressive form of the disease. There are different variations for both relapsing and progressive, which is a little more complicated than we need to get into. But the challenges that we face, that the scientific and medical community face, are understanding what those differences are in the disease. Why?
Like from a genetic perspective or
I think
neurological perspective?
Both. So we call it a neurologic disease, but it's really the immune system acting inside in the nervous system. It's an autoimmune disease, although these days we've moved away from labeling it that way. The immune system is attacking the central nervous system. So, I mean, that's complex right there. And it's hard to understand, but for example, the progression of the disease, meaning continual disease activity. Why did it not go into remission at that person? Big question, don't know the answer. In addition to that, what are the other processes happening that result in nerve damage? So in a relapsing form of MS, where the myelin is stripped away from the nerve, you get that short-circuiting, but the body can regenerate the myelin naturally, and you go into remission. Don't understand that process completely. But in progressive forms of MS, that remyelination doesn't occur. And because the nerves are exposed now for prolonged periods of time, you can actually get nerve damage where the nerves are broken. And there is a symptomatic treatment on the market that helps with the conductivity of the signal. So even if you have like a secondary progressive form of the disease where you don't have that dramatic disability, if you have a limp, persistent limp, for example, these medications improve walking dramatically. But it doesn't inhibit disease activity. So it's just so many different levels that it works on. It's difficult for the doctors and the medical researchers to understand what's happening.
Now, when you first come down with some of these symptoms, there's no way currently to tell whether it's the progressive or the remissive forms unless it goes away.
That's correct. So
So when you first contacted the doctor and you first had your MRI, you were still you weren't sure at that point which version?
I think in the course of my treatment and over the 5 days in the hospital, when I did get better, they suspected that it was relapsing remitting MS. And then, of course, had quick follow-up, pretty regularly with my neurologist and stayed in the...
So you knew within a week, but...
I think. I honestly don't remember specifically if he ever used the words relapsing remitting at that time. But I did get better quickly with treatment.
Does one ever change forms?
So there's primary progressive and there's secondary progressive. So somebody can right off the bat get diagnosed with progressive MS, or my MS could turn into progressive, which would be secondary progressive.
Okay.
So that's what we're trying to prevent.
I don't blame you. I was thinking of another question and I forgot, so I better look at my cheat sheet. Neurological issues are found in several different diseases. And how easily or difficult is it to determine if somebody has neurological issues, if it's definitely MS or if it's something else neurological?
Well, my understanding is that because symptoms such as optic neuritis or other symptoms that a person would experience could be caused by different factors. That's one reason why the diagnostic criteria for MS says that you have to have 2 different attacks over a period of time. So optic neuritis in one case, and then numbness and tingling in another. So that's for a definitive clinical diagnosis of MS. But as we discussed earlier, because several of the medications have been approved for pre-treatment, if you will, before a clinical diagnosis, doctors are more willing and more ready to say, from my experience, I'm a specialist in MS, and my experience, this looks like MS to me, and I'm going to start treating you with this. And that way we can inhibit you from ever having a second attack, or if it does occur, it'll be less severe and it'll be a long time from now. So, but there are a number of different diseases that have similar symptoms. MS and lupus can sometimes be confused for each other when they're both in mild stages. When there's a lot less information for the doctors to work with, it's harder to make a clear diagnosis. And this is where my not having a medical background limits my ability to answer the question. But from
my lack of medical background prohibits me from understanding the more technical background. What
I've heard the doctors talk about, and the other medical professionals, is that when they see clear evidence on MRI scans and they observe the individual, they these days can make a pretty good statement as to what's going on, and they prefer to treat them right away rather than waiting for another episode to happen.
So like in the past 20 years, a lot has kind of become a little more concrete.
Yeah, and for the most part, the drugs have, not dramatic side effect issues. Some people always have worse side effects than others. But the flu-like symptoms that Jodi talked about with the interferons they're just that. They're flu-like symptoms. It's sort of a temporary reaction the body has to the medication where they would experience fever and chills, but it's not a symptom
I don't think I'd want to go through that on a regular basis, though.
No, it wasn't fun. It didn't happen all the time either, so you couldn't predict it. Like some weeks it would and some weeks it wouldn't. And they give you things to do. They suggest drinking a lot of fluids, being well hydrated, taking some ibuprofen or something before you do it, but it was still unpredictable.
Now, going back to you, since your diagnosis and since you've been on the medication, have you noticed any changes in your life? Have you been limited, or how has your life changed since your diagnosis? Like physically?
Well, I try to take better care of myself and to, know my limits so that I don't get to a point where I'm having symptoms. But the biggest thing I struggle with is the fatigue. So I've had to learn to deal with that and sometimes I just can't do as much as I used to be able to do.
Okay.
I don't think it has anything to do with aging either.
Could blame it on that.
Yeah, you know. So just trying to, know my limits, know how much I can schedule to do, know how much sleep I need to get. But it's challenging because I think we all tend
everybody's got to figure out how much sleep
overextend ourselves. And, right now I have a cold, and I find when I get a cold, it's much worse. Like my fatigue comes on. I'm much more limited in how much I can do. I have a harder time functioning at work. I think everyone does when they have a cold, but I feel like with the MS, it even makes it that much worse, where it's like I can't think quick on my, my thoughts that I want to say, and I feel more achy and fatigued.
Well, it's common for people with MS to say, you have a reserve, right? When you get tired, you kind of say, all right, well, I'm feeling tired, but I need to push through, and you sort of use this so-called reserve energy. But for folks with MS dealing with fatigue issues, there's no reserve. They run out of gas, they're gone.
Go take a nap.
Yeah.
Okay. And I actually take a medication to help with the fatigue that is a medication that's just used for symptom, for a symptom. It's not an MS modifying drug, which is really helpful, and I can kind of take it as needed. So I mostly take it on work days, and I find that to be helpful. So luckily there are some things that can help, but it can be challenging because, again, it's so unpredictable. And some days I might feel great, all day, and all of a sudden the fatigue will hit. It's not like it's a lot of warning, like, people who get tired throughout the workday, they know they're tired and kind of comes on with fatigue and can just hit all of a sudden.
Oh, nasty. Now, you mentioned that when you were first diagnosed, you wanted to participate in a walk, and your family did that with you. Sounds like you've been doing the walk on a regular basis?
Yep, I think this will be our 7th year. 8th year, I don't know.
And you're branching out this year, I heard.
Yeah, we've always done a lot of events, several walks. This year, for the first time, we're doing the Ride the Vineyard, which is a bike ride with different levels of how far you have to ride. So figured it was a good place to start since I don't even own a bike.
That's a first step. Would probably be acquiring one of those. So how long is the vineyard ride? Is it like measured in miles?
There's 3 different options. Yeah, it's like estimated about like 20, 40, and 60, I think. I don't think those are exact numbers.
I think I would crash after 20.
So you can pick which one you want to do, and I figured.
Now, how would you train for that?
I've been taking spin classes at the gym.
Oh, cool. You're going to have to get a bike soon.
Yeah.
And a helmet.
Well, you have to have a
I have
helmet,
some people I can borrow from. That'll figure out.
You can rent a bike on the vineyard. Actually, there's bike shops that come to the Martha's Vineyard High School, and it's called Bike MS Ride the Vineyard. It's May 2nd, the first Saturday in May. It's a lot of fun because...
Is it rain or shine type thing?
Rain or shine, yes.
Oh, yeah.
Rain or shine.
And I know that it's rained many years that weekend.
But we've also had great weather. There's been beautiful, absolutely gorgeous weather. And last year, in fact, was just absolutely perfect.
So
not too hot.
Hopefully 2 years in a row we'll get that.
We're knocking on a lot of wood today. But that has a higher fundraising minimum. You have to raise at least $250 to participate in the bike ride.
To get the T-shirt. No.
Yeah, everybody gets a T-shirt, but no, to be there, you really need to do the $250.
Okay. Now, is that also a team thing, or is that like more also?
Everybody can participate as an individual in any of our events, but they frequently participate as part of a team because it's just more fun.
Yeah.
A lot of times you'll find situations like Jodi's, where she's a person with MS and she says, hey, I'm going to do this. And she starts asking people to make donations, and they say, well, you know what, I'm going to walk with you too, or I'm going to ride with you too. And then they start, raising money as well. So you oftentimes will see the teams that have a person with MS at the center of them, not necessarily participating. At walk, it's not uncommon to see somebody in a wheelchair, but they're out there participating. The family is
handing out water,
wheeling them along. Well, they do that too. At the bike rides. You'll see people with MS at the rest stops, at the start line, finish line, helping out, being part of the activity, being part of the day. And it's a really special bond that you get between people who participate at the events and the folks that benefit from it as well, because they know that, especially some of our events are very physically demanding. For example, on March 7th, we had the MS climb to the top of the John Hancock Tower, 61 flights.
Inside the building, please.
Inside the building, yes.
Okay.
Going up the stairwell. 61 flights of stairs inside the stairwell. That's a
Okay.
very demanding
Yeah.
physical activity. We have a team
After
that runs
3 flights, I'm ready to crash.
going up, 6 stairs would be enough for me. But the marathon, the Boston Marathon, we have a team of some 60 or 70 runners
Wow.
who and they have a $4,000 fundraising minimum to participate, in addition to running 26.2 miles and beating up their bodies. So we have some very challenging physical experiences, and it's not lost on us that these challenging physical activities have a lot of symbolism for MS.
Okay.
If you're a cyclist and you're doing the 60-mile ride on Martha's Vineyard, around mile 40, you might be feeling pretty spent. Say,
Yeah.
well, you know what, I'm done, I'm tired, I'm not going to do this.
Mm-hmm.
But you can get off your bike and you can rest, and then you'll feel fine, and you can keep going. But for a person with MS, they don't get that
Call the
chance. They
van.
don't. Yeah, their MS doesn't go away after they rest for a few hours. So people keep that in mind as they participate in these bike rides, and they push themselves to accomplish the goal, and they push themselves to fundraise as well.
Okay. Now, again, before the show, you were mentioned like the bandanas, the
The
what did you call it?
champion
The
program,
champions.
yes, for Bike MS, the champion programs. Many of the cyclists who participate, and we have 8 rides. There's the Ride the Vineyard in May. In June, we have the Cape Cod Getaway that goes from Boston to P-Town, 2 days, 150 miles.
Wow.
There's a similar 2-day ride in Maine in August and in Vermont in August. There's a 1-day ride in Concord, Mass. in July, the Minuteman ride. And there's a 1-day ride actually there's a 1-day ride in June, the Berkshires. Out in the Berkshires, we ride Mount Greylock and other parts of the western part of Mass.
Okay.
And then in August, there's a 1-day ride in New Hampshire. So there's lots of choices, distance,
Lots of options.
or strenuous, whatever you choose. And it presents people with an opportunity to test themselves. But the average fundraising is generally very high. People would raise upwards of $1,000 voluntarily, but they may only be required to raise $500, say, for the Cape Cod Getaway.
Okay. Now, you mentioned bike rides, walks, and climbs, and all this physical stuff for fundraisers. Is that coincidence or is that deliberate? And do you have any non-physical fundraisers?
It's deliberate. It's there to provide people a challenge. When people are presented with challenges, they rise to the occasion, and it's symbolic of the fundraising also that they have to do. And it's a motivating factor. Here's this great thing to do, raise some money and have a good time doing it, and it brings people together in a community. But Jodi also participates in our Fashion Plates luncheon in November, which is a fundraising event that is very successful. 500 people at the Boston Sheraton Hotel in November, and the women who model are all everyday women like Jodi who have MS, and they get to have a blast wearing different great clothes.
Do you get to keep the clothes?
No, but you can buy them with a discount.
Well, at least they give you a discount.
And she actually donates a portion of the sales back to the MS Society.
Oh, cool.
It's Lisa Lynch at Ports and Company Cohasset, to give her a free plug. I don't know if that's appropriate or not, but she's wonderful. She's been doing it for a number of years and is very giving and works closely with the women to give them a great experience. And it's really a moment that transcends the fundraising because it just says, you know what, I'm out here, I have MS, and I'm going to have a good time. It's not going to stop me.
Do you get to pick your outfits?
Yeah, she helps you, and you get to have some say. Obviously, she's not going to put you in something you're not comfortable wearing, but you definitely
Pink
wear
taffeta.
things a little bit outside of your comfort zone or things that you might not normally wear, but that's part of the fun of it.
Oh, yeah.
So you can just buy a ticket to the luncheon, and there's auctions, raffles, and have a good time at lunch, watching women on the runway, having a great time, cheering on their friends, and and you don't have to ride 50 miles.
Yeah, that would be me. So all of this information is available on your website?
Right, so there's msnewengland.org, which
Okay.
is our local website, and everything that we do is on there. It's listed under fundraising events. There's a calendar at a glance. Like I said, we started on March 7th with the climb. We'll go all the way into November, Thanksgiving morning. We have a 5K run in Brighton.
Now, if somebody wanted to volunteer for the MS Society, without biking 50 miles or without running, or, are there other opportunities to volunteer, either work at some of the walkathons, handing out the water or registration, or office work or anything?
All of those, the answer is yes.
I actually volunteered at the stair climb in March. Me and a few of my friends, we did registration and helped people with checking in so that we could still be a part of the event, but didn't want to climb those stairs. We do enough, so that was a great
down
way.
The stairs when gravity is my friend.
Yeah, so there's also, my mom's volunteered in the office before, helping with mailings, helping with like putting packets together for walks. So there's lots of different ways to get involved.
And many of the programs that we do, the educational programs for people in families affected by MS,
which we never talked about.
The doctors volunteer their time. The other health professionals, physical therapists, occupational therapists, they volunteer their time to help educate people as well. So if people have a particular skill, talent, or profession, there's a possibility that might fit into what we do as well, that we could use them as a skilled volunteer. But equally, the volunteers at the fundraising events and in the office to do all the mailings and to support our operations. It's incredible. We have a huge success rate of volunteer hours. I can't begin to quantify it. Just thousands of volunteer hours that make us work. We wouldn't be able to operate without it.
Right. Well, on that note, we are out of time, believe it or not. I do want to thank both of you for coming, and best of luck in the walk and the bike. Are you doing both this year?
Yep, and the challenge walk, which is a 50-mile walk. So I have a few things coming up.
Best of luck.
Thank you.
Make sure you drink lots of water. Have that support system with you. And I do want to thank everyone at home for tuning in, and hopefully you enjoyed our conversation as much as I did, and hope you found it as informative and as educational. So thank you very much for tuning in. Have a wonderful evening, and I'll see you around town. Thanks. Good night.